You may have heard there are new initiatives to expand Medicaid in South Carolina, but what you haven't heard is that those initiatives are coming not from where we expected them to come, from conservatives that want to privatize the Medicaid money, but from liberals that fear that that's the only way we're going to get the money in South Carolina. And we feel, the Progressive Network feels, it's really important to be truthful with people, that if we're going to have to swallow a bitter pill, at least let us read the label. And that what is happening is that the Health and Human Services, the federal agency, is allowing states, so far there's been 6 Republican states, to take the Medicaid money that was a public option to be able to provide Medicaid services to people below the poverty level because they don't have any money. And so they're allowing states, Arkansas was the first one, and everyone's referring to the Arkansas model, to take the $1 billion+ and privatize it, put it into a cabinet agency in South Carolina. Nikki Haley appoints the head of our Health and Human Services, and they would then subsidize insurance for poor people by buying them an insurance policy with a private company like Blue Cross Blue Shield. It's a really bad idea. It's a bad idea financially. It's a bad idea from a medical standpoint. It's absolutely obscene making that type of money off of our tax dollars by ripping off poor people, privatizing poverty. That the demographic that they're talking about expanding Medicaid to with what's called the private option. Now, anybody comes up to you and starts talking all glowingly, whether they're Democrats or liberals, all glowingly about this new plan to expand Medicaid, ask them, is that a private option? And ask them who's going to pay the extra expense that the federal government said that if you take the private option, the state has to pay the difference in the administrative fee. Medicaid administers the fee for maybe 3%. Blue Cross Blue Shield gets 15 to 20%. We have to pay the difference. And so this idea that the conservatives that have been opposed to the Affordable Care Act, our governor's been railing about how we can't afford the 10% match that would take. And we don't want the government to get between us and our doctor. What's happening is that people like Governor Haley in these Republican states are taking this Medicaid Section 1115 waiver, privatizing the money, and letting corporations get between poor people and their doctor, and charging poor people. They'd have to pay a deductible and a premium, and if they don't, they get kicked off. Oh, and if they're too sick, they get called out and they get put on traditional Medicaid, which cost us 5 times as much as the 10% Nikki said we couldn't afford to begin with. So it's rather complicated, but the bottom line is we're going to get screwed if we expand Medicaid with the private option. Stay tuned for more information from the Progressive Network.